Good morning, ladies and gentlemen, my distinguished panelists, and all the viewers. I'm Dr. Nishant Sharma, and I welcome you to the series of virtual discussions on arthritis in India, a national-wide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we'll be talking about different spaces in arthritis and its care in India. We will be talking about what is arthritis, its management strategies, advancements for patients living with arthritis, and strategies for improving its care. Today, I welcome my experts from Punjab. I have with me Dr. Aarti Diwan, Consultant-Orthopedician, SGRD Hospital, Ludhiana, and Chairman of WOICE. Good morning, ma'am.
Thank you, Dr. Nishant, for giving me this opportunity to be here with awareness of arthritis, because arthritis, is becoming the most important, other than AIDS and diabetes. It's becoming one of the important causes these days, and it gets misdiagnosed. People are not aware with it, and at the end they get investigated, they diagnose as a case of arthritis. So carry on, Dr. Nishant.
Yes, I thank you for this lovely introduction. We will also be joined by Dr. Atul Sharma, who's consultant robotic arthroplasty and arthroscopic surgeon at IV Hospital Hoshiarpur, and Dr. Sanjeev Mahajan, director orthopedics, joint replacement and arthroscopic surgery, Fortis Hospital, Ludhiana. They are running a little short on time, so we should be having them joining us very soon. Today, we will be discussing about the different sections, like I just said. So, starting this panel about arthritis by understanding arthritis. So, Dr. Aarti, my question is, can you provide an overview of the different types of arthritis there are in India?
Yeah, arthritis, actually, we know in layman, it's like for a simple man, हम क्या कहते हैं उसको हिंदी में कि हमें स्वेलिंग है पंजाब में, ठीक है, हमें सोज है, हमें दर्द है, हमें कहाँ दर्द है, हमें जोड़ों में दर्द है, हमारी बॉडी में दर्द है. एक आजकल ये बहुत है कि हमारी जोड़ों में दर्द है, हमारी बॉडी में बहुत दर्द है. तो आर्थराइटिस जो था, पहले हम सोचते थे कि आर्थराइटिस है तो हमें ऑस्टियोआर्थराइटिस होगा या रूमेटॉइड होगा, हमें दोनों तरफ है, एक तरफ है, हमें यूरिक एसिड है, हमें गाउट है, हमारी यही नजर में होता था. पर आजकल क्या है कि हमारी बॉडी में ही दर्द है, वो ही हमें लेकर जाता है कि हमारी आर्थराइटिस है, हमारी सोजन है. तो हम जो कॉमन जो है सबको आप देखेंगे, I being a female, so mostly I get encountered with so many women who have been with the arthritis. Like the women, they have very much prevalence of arthritis. So I also deal with bone and joint health, and that is the utmost. If your health is not good, woman is the whole in charge of the family, right? So the commonest thing I have seen in my OPD and in common practice, that is fibromyalgia and arthritis. So people always misdiagnose that either it's arthritis or it's fibromyalgia. So fibromyalgia is a big term. The people, they go in surgery too. The people go in medicine. The people go because it's a multi-speciality. Arthritis is a multi-speciality. It can be being an orthopedic surgeon. So arthritis, we divide, like the commonest is osteoarthritis. It can be primary, it can be secondary. Primary, as you know, that the primary cause, that swelling is there. But secondary, there are different causes. And secondary arthritis, that leads to other disorders in our body, right? That can lead to obesity. Obesity is not cause for arthritis, but arthritis can further lead to fibromyalgia, obesity, diabetes, and so and so. The prevalence of arthritis, as you know, it's very, very high as compared to other disorders like common, like diabetes mellitus, AIDS, cancer, but we are not aware with it, right? As it is a World Arthritis Week, or we can say Arthritis Week. So main motto is that what kind of arthritis, and people should be aware of that arthritis hota kya hai. तो मैं दोबारा से ये repeat करूंगी so that it's for voice of healthcare that हमारी जोड़ों में जो दर्द होती है वो only arthritis नहीं होता, हमारी बॉडी में, हमारी मसल में, हमारे टेंडन में, हमारे लिगामेंट में जो भी दर्द होता है उसको भी हम सूजन को हम बोलते हैं. पर जब जॉइंट इन्वॉल्व हो जाता है तो फिर वो प्राइमरी भी हो सकता है, उसका secondary भी cause हो सकता है. I am also conversating in English as well as Hindi so that it's gets clear. But I belong to Punjab, so I can also get conversated in Punjabi too, right?
Right.
So
Right.
एक हो गया हमारा ऑस्टियोआर्थराइटिस. ऑस्टियोआर्थराइटिस जो है आइटस, मतलब आइटस किसी के साथ लगा मतलब इन्फ्लेमेशन, तो प्राइमरी कॉज है. सेकेंडरी कॉज है, अब हमारे जमाने में ये होता था, हम पढ़ते थे कि रूमेटॉइड अर्थराइटिस, राइट? रूमेटॉइड अर्थराइटिस है. तो अब जो जमाना आ गया है रूमेटिक डिसऑर्डर्स का आ गया है. तो रूमेटिक डिसऑर्डर्स में ही ये हम इंक्लूड करेंगे ऑस्टियोआर्थराइटिस, एंकिलोजिंग स्पॉन्डिलाइटिस, जुवेनाइल फाइब्रोमैल्जिया, गाउट, सूडो गाउट. So these are the causes, ठीक है? So primary and secondary. तो एक degenerative होती हैं, तो degenerative arthritis में नहीं गिनते, पर वो degenerative में गिनते हैं. पर जब हमारी बॉडी में विटामिन डी कम हो जाता है, या सूजन कम हो जाता है, या हमारी इन्फ्लेमेशन जब बढ़ जाती है, सूजन मतलब इन्फ्लेमेशन, इन्फ्लेमेटरी मार्कर्स हमारी बॉडी में बढ़ जाते हैं, तो तब हमें ये आर्थराइटिस होता है. Either it can be up now these days, coming up with the younger generation, the coming up is rheumatic disorders, the spondyloarthropathies, ankylosing spondylitis, that is very common in seen in younger age groups. Clear? So
Yes.
मैं nutshell में यही बोलूंगी that prevalence is around 20 to 20%. It has increased. हमारे जैसे हम age group में divide करेंगे तो 14 to like say 45. So it's like 7%, then from 45 other onwards, rheumatic, and then after 60, we consider the osteoarthritis. But osteoarthritis, you know, is the commonest, and then the rheumatic disorders. So rheumatic disorders includes osteoarthritis, can be rheumatoid, can be spondyloarthropathy, can be ankylosing spondylitis, can be fibromyalgia, can be gout, can be pseudo gout, can be juvenile rheumatoid arthritis. So in nutshell, this is what the types are, and this is what the arthritis is. अब बात करें हम arthritis के features की.
Right. Some
तो हमें
symptoms
होता
around
क्या है?
arthritis. Right.
Yeah, symptoms क्या होते हैं? Joint में swelling, pain. तो ये वेग से टर्म है. तो होता यही है कि हमारा arthritis शुरू होता है. Patient बोलता है कि मेरे को दर्द हुआ. तो sometimes क्या होता है? Vitamin D. That's the commonest thing that leads to anti-inflammatory foods. That's the commonest thing that these days arthritis is going on. Then our sedentary lifestyle, that is the commonest thing, sedentary lifestyle. Why the older people, they are much better than the younger generation? Because in every plate they are given, the parents have spoiled their children too. It's
Right.
not that. And moreover, the diets have, what the junk diets they are going on. I mean, the gluten which is involved with the adulterated foods we are taking, that is also leading to, because it's wide. So cutting short, that what are the factors that leading to, what are the risk factors, what are the precipitating factor, the types I have enumerated. So I think so. Let's continue with other questions, Dr. Nishant.
Thank you, Dr.
And
Aarti,
if
for
you
this
want
wonderful.
something out of my mind.
Yes, obviously. Thank you for this wonderful introduction to this series. I mean, you have provided a good outlook for everyone who has just joined or was a part of this. So, talking about some common symptoms, as you were saying, can you also describe some other symptoms that are involved apart from joint pain, which can help create awareness about the different people who are watching it?
Dr. Nishant, stiffness, that's the commonest thing. Stiffness, redness, pain, body aches.
And this is prevalent around all the age groups who are experiencing arthritis.
Definitely. Now coming to now see, there is a variation. Pain and stiffness. Stiffness is now you can see in younger generation too, in older generation too. So you have to segregate it out that what we are looking for. So that also depends upon your investigations, your clinical sense, how you see the prevalence, where are you living, in which state it is prevalent, which is the socioeconomic status. So there are different kinds, but otherwise arthritis, if you think of inability to, if I say that patient is not able to, patient is obese, right? Patient has stiffness. So there could be so many causes for that. So segregating. So one thing is age, the socioeconomic status, the diet, your lifestyle, your prevalence, where are you are seated, that your climate conditions. So there are so many things that you have to collaborate, and then you have to make a diagnosis according to your clinical sense. But these days, the diagnosis is, based on radiological investigations, your blood investigations. But we have to seek out first the history. It's not that
Right.
pain and stiffness is in young or in this is not that. But prevalence, if you see, stiffness is very common in juvenile. You're talking about juveniles and all the joint pain. So how can the child be? It's the parents now who are living there. They are saying that remissions and wo are there. So it depends that how you carry the symptoms, and you have to differentiate between symptoms and signs. Sometimes it's like symptom. Arthritis is like symptom. So arthritis can be a disorder. It leads to so many disorders further. So it can be symptom, it can be sign too. So that's your clinical sense, how you carry.
Okay, and like you were talking about the prevalence in different parts and different regions of India, can you put some light on that as well? Give a couple of examples about where is arthritis more prevalent in the subcontinent of India as we see.
Prevalence in, if I talk about in socioeconomic status, in socioeconomic poor low status, if we think of, so it only comes in our mind tuberculosis, right? Tuberculosis, it comes in our mind. But tubercular arthritis is very common in socioeconomic status people. But now tuberculosis is very common in high socioeconomic status people too, right? Okay. So that depends upon the regions. Now, if the patient is from Bihar, right, and if they are migrating to some different city or something different, so it also depends upon the state too. It depends upon your diet. It depends upon how your lifestyle is. So there are different and prevalence and incidence. There is difference. So incidence is, prevalence is that in this state, this was the prevalence earlier used to. Prevalence in India, we find out it's like 20%, 15 to 20%. Probably in 22, it could be 22%. Now in 23, I have not seen the data, but still like it's one of the commonest causes after seeing after like cancer, and I've told you diabetes. So prevalence, you have to differentiate between prevalence and incidence. Incidence is that how much new people are coming, incident. And prevalence is that older prevalence that some retrospective study has taken, right? If the patient has migrated from there, so that will be the incidence that in so and so, like 1:2, that in this age group, this is the incidence. But prevalence is in the whole thing, right?
Right. So like you were talking about diagnosis, and you were saying that it's the clinician's discretion and the clinician's understanding along with the radiological analysis when they're making the diagnosis. I want you to comment on the importance of early diagnosis, and let's say the impact that early diagnosis will have on the treatment outcomes of individuals that we see with arthritis.
Okay, in early diagnosis, what you have to do is when the patient comes in an OPD, or when you encountered a patient of arthritis, either it can be primary or it can be secondary, or it can be associated with any disorder. So main is that patient, we have to go for blood investigations, the basic blood investigations, ESR, the CBC, the complete blood count, then RA. RA now it's like, it can be seronegative too, right? So seronegative arthropathies. So these are the basic investigations. C-reactive protein we have to go for. So that earlier we used to, only patient has in the mind ke mere ko uric acid karana, mera uric acid hoga bas. अगर कोई भी ओपीडी में आएगा, मेरा यूरिक एसिड है, मैं खाता हूँ, मेरा प्रोटीन कंटेंट इतना है, तो मैंने नहीं कराना. So early diagnosis में now the government hospitals have come up, so the things have come up. So the ESR, that's the commonest. Of course, it's insignificant, but still it gives you little bit that some inflammation is there in your body, so that you can correlate with. Then radiological, the basic these things to go, and then further, what are your diagnoses? Now X-ray, people now see, if we see X-ray pelvis with both hips only, but patient has pain, localized pain on the SI joint, right? So on this, grade 1 can't be detected. So further investigations for ankylosing spondylitis and spondyloarthropathies, MRI has come. But I will ask you that whether you will first go for MRI In a first go, if arthritis is there, I tell you. If I ask
No.
you, go for an MRI. No, right? So you should be aware of it. You should examine it, the tenderness, the history, and the investigations further, because it delays the process. It delays the process in your treatment, and then further aggravating the further effects, and then further it leads to so many inflammation in your body that it leads to inability, disability. That is what is
So
required.
I think
So
that
basic
is how
investigations,
early diagnosis is
that
going to help
basically, yeah.
in, right. Please continue. Please continue, Dr.
If
Aarti.
I
Yes.
if I ask you in an OPD, you come, and from my clinical sense, I say that stiffness is there. Stiffness is there are so many causes of stiffness. So sacroiliitis can be there. Okay? Say because of sacroiliitis, ankylosing could be there. So in ankylosing, I tell the patient to go for HLA B27. But my clinical sense is saying that there is some stiffness is there, morning stiffness is there, night stiffness is there, at rest the pain is there, joints are involved. If the pain is there, fibromyalgia is there, might be the vitamin D deficiency there, might be the stiffness can be because of other causes. So you have to connect with that. Patients, they don't go in early. If there's a difference between corporate and the general hospitals too. So patients, they don't go for. If we talk about in high socioeconomic, तेरे को तो पेन हो रही है टीबी में. I'll ask you one question, that if you have an X-ray LS spine, you have to see पेन हो रही है, तो you'll say कि मेरे को तो मैंने तो पेन किलर खाई, बस पेन से दर्द होगी. But that has been progressing in your body. So you have to understand that you have to make aware of the people that don't ignore your symptoms. Either it's early stages, because these leads to early diagnosis. The symptoms should not be ignored. Women's, they always ignore. Women's, I see nobody, they always ignore. Me too will also ignore. But I have to see my patient. I have to do my work. I have to see my family. But ignorance. So that is what to avoid disability. So we have to go for early investigations.
Right. I think that is why, Dr. Aarti, we are hosting such awareness panels, so that people who might have certain symptoms get a little aware, get a little precautioned about it. So, like you were talking about how a clinician uses their judgment and their discretion and understands and makes a diagnosis. Let's talk about what happens after diagnosis, which is arthritis management. So let's talk a little bit about some management strategies. So could you discuss about some medical, some lifestyle change approaches that you usually deploy while managing a patient with arthritis?
Me, actually, I am a chairman of WOICE, Women's Orthopedic Indian Association. So what I mean is, because this year it's a theme is that strong bones and strong nation. Right. This year, our IOA is having a theme of strong bones and strong nation. Right. So bone health and joint health, that is very important. First is your diet. If I ask you one question, what was your breakfast today? What have you taken in your breakfast? So that's the answer. That's the answer. I mean, what should I say? We are ignoring our health because we are after our work, but we are not concentrating on our diet. If we see doctors, preferably me, what I have taken in my breakfast, I have to go in the OPD at 8. But simple thing is that in the morning, we can't take a glass of water. We can't take, say like coconut water to avoid our acidity. Only we think in our OPD, I just see in the morning, I had seen 50 patients, and out of 50 patients, टेस्ट के लिए मैं आई हूँ, मैंने सिर्फ चाय पी है, मैंने चाय के साथ रस खाया है. So that's the answer that lies behind. So what to manage first is your diet, your lifestyle. So always laugh. For me, to manage everything is stress should be less. In management, every disease, stress, laughing, diet, lifestyle modification, then comes your medical management. Of course, medical management, we can give painkillers for 6 weeks, for 2 weeks, depending upon what kind of arthritis it is. Now, a newer generation of orthobiologics have come. So that is in 6 months or probably 1 year. But because of cost constraints, people, they don't go for. But people, they go for medication, but they don't change their lifestyle. They don't change their diet.
Mm-hmm.
So medical management depends upon, for example, if a patient of osteoarthritis is there. So osteoarthritis can be different grades. So in grade 1, grade 2, grade 3, grade 4. So in grade 3 till grade 3, we can go with medication. But if it is grade 4, along with obesity,
Mm-hmm.
so very good results are there with surgical intervention. So
I see.
along with medical and surgical, so we can both combat arthritis.
Mm-hmm.
So medical management, depending upon what kind of arthritis it is, so we give our treatment, whether we give local like NSAIDs, we give disease modifying drugs, or we have to go for newer generation of painkillers, newer generation of orthobiologics, and then
Mm-hmm.
coming to surgical management.
Right. And these different treatment modalities, how do they vary between different age groups? Let's say if you get a very young juvenile patient with arthritis or someone who is 65 with arthritis, does or does not, does that change the treatment modality that you will be using?
See, in juvenile, for example, if we take septic arthritis, that depends upon that it's acute, it's chronic. So acute is like, you have to give IV antibiotics. That depends, right? And that stage. If we're talking about in juvenile, could be tubercular arthritis at hip 2. So that depends. ATT would be there. If it is rheumatoid, so the main, for example, for rheumatoid, so the duration will be same. Tubercular, the duration will be same, right? Age, depending upon the dose. So it's like if it is 5 grams, so you have to give according to the weight. If it is rheumatoid in later stages, so you have to give the medication according to your weight also. But this basic thing is that rheumatoid may, that if disease modifying is there, so disease modifying will there. In tubercular arthritis is there according to the age. So you have to give, in children you have to give different dose, and in younger adults you have to give different dose. Sometimes it could be because of trauma, there could be osteoarthritis, there could be degenerative changes that further lead to so many disorders. So that depends. Age is there, definitely. Medication is according to age. For example, pediatric dose is different. So it's in younger is different, and in older. But osteoarthritis could be primary, could be secondary. But some, like, disease modifying drugs, orthobiologics, acute, chronic, there are different, for example, ankylosing or spondyloarthropathy. If there is acute reversion in young patient, so now new orthobiologics, they have come. But if there is chronic, so we can go with the disease modifying, or we can go with some any indomethacin. Some people go with the Sazo, some people go with NSAID only. So it depends. Plus, along with that, diet, of course, you have to alter. Lifestyle modification, you have to alter. So definitely age has an important factor. Talking about different kinds. That's why we should know about the types of arthritis and how to manage, how the age matters, and how in some diseases, like, treatment depends upon dosage, treatment depends upon your lifestyle modification. So
Right.
depending upon the coming and focusing on the diagnosis. So early diagnosis is very important.
Right. So I think it comes out as a multidisciplinary approach while we are curating any
Definitely.
management
Because some
strategy.
patients, they go to because it's like, multidisciplinary. Some patients of arthritis, they go to endocrinologists, they go to physician, they go to orthopedic surgeons, they rheumatologist. So it's like different. This is a multi-specialty arthritis. So different, and this is an awareness, so that if the patient comes, so early diagnosis, either at any super specialty people, early diagnosis should be made, so that it should be referred to whatever the case is. If it is rheumatology, refer to rheumatologist. But there's no line cut, but we have to diagnose it, so that patient should get relief as soon as possible. If I would patient, I wanted that as soon as diagnosis become, I should be relieved, and I should be relieved from the medication.
Right. Very, very correctly said, Dr. Aarti. Talking about you mentioned a couple of the treatment modalities. Are there any recent advancements or innovative therapies that we are seeing in arthritis management that you would like to recommend exploring?
Yeah, definitely. Now I am also coming up to this. Orthobiologics have come up.
Hmm.
Orthobiologics have come up. Xanase inhibitors, they have come up for ankylosing spondylitis, but orthobiologics like mesenchymal stem cells, they have come up because
Okay.
patients are not going for surgical, they don't want to get replaced, right? They don't want to. If osteoarthritis is there, patient say that ठीक है मुझे PRP हो गया, so plasma rich, right? Platelet
Hmm.
rich plasma has come up. So mesenchymal stem cells, they have come up. But
Hmm.
different kinds of these new things have come up. Progenitor cells have come up. And this company Orthobiologics, they are coming up very fastly, but that depends upon telling you that diagnosis at the right time and at right, because grading is very important. If grade 4
Right.
is there, what can I do? I can't do anything at grade 4.
Correct.
बाल सफेद हो गया तो वो सफेद हो गया, वो काला नहीं होगा. आपको समझ आ
Yes.
रही है? तो वो काला
Yes.
ही रहेगा, उसको कैसे आगे कर सकते हैं?
Huh.
So you try to understand the grading is there. So grading is very important. Newer
Hmm.
things have come up with that. Investigations have come up with that. So early diagnosis with the investigations it come up with. And I think so government of India, they are trying it very hard at government levels, so that investigations should be, patient friendly, and they should be, pocket friendly too, so that early diagnosis that leads to, if we have newer innovations in
Hmm.
arthritis, so they should come up with. And grading at for example grade 1, so arthrobiologics, they are coming up very, if grade 1 is there, so I would advise that diet alteration and exercises,
Hmm.
strengthening exercises, they are very common. If for example ankylosing spondylitis, this I ask you rheumatoid, गठिए की प्रॉब्लम है, तो ये वो सारी उम्र ही रहनी है, वो अंदर सारी उम्र ही रहनी, कभी बढ़ जाएगी कभी कम हो जाएगी, पर नॉर्मल लोगों को यही नहीं पता होता कि हमने डाइट में क्या खाना है. सो इट्स लाइक मैं बोलूं कि ब्रिंजल है, अब ब्रिंजल है, टमाटोज है, अब नहीं खाने चाहिए, दैट इज नॉट माय डोमेन. सो इट्स different specialties. Dietitian plays a role, the
Right.
endocrinologist plays a role, physician play a role, me as an orthopedic surgeon play as a role. मैं चाहूंगी तो मेरा ये है कि मैं सर्जिकल मेरा फील्ड है, राइट? सो
Hmm.
स्पाइन में है, लाइक आई एम इन्वॉल्व विद स्पाइन, सो स्पाइन में कितनी एंकलोजिंग होती है, फ्लोरोसिस होती है, तो डायग्नोसिस बनाना अर्ली वेरी इंपॉर्टेंट है. अलॉन्ग विद
Hmm.
स्पाइन में अब कितनी कंडीशंस है ऐसे जो पेशेंट को हम कहते हैं कि एक्सरसाइज से ही ठीक हो जाती हैं. हम दवाई दे दी, 4 दिन हुआ, उसने थेरेपी कराई, उसने मोडेलिटीज लगा दी, पर एक्सरसाइज घर पे की नहीं उसने.
Hmm.
जब भी उठेगा सीधा उठेगा, घुटने बार स्क्वेटिंग करेगा. आप मुझे बताएं कि कितने इंग्लिश टॉयलेट्स हैं आजकल और कितने इंडियन टॉयलेट्स हैं. So that's a
Right.
simple answer too. So to the children we
Hmm.
are not giving, but we are giving, the luxurious life.
Right.
So there are so many answers and so many questions, but cutting short, that newer innovations have come, but grading is very important. And early stage, if grade 1 is there, why not, if without orthobiologics, newer innovation, if with the diet and if with the exercise, the things get not worsen, why not that?
Why not? Correct.
Why to get medication? Why to get medication?
Right. Hence, I think our awareness and having people listen that it's about getting an early diagnosis, and because there are treatment options and treatment therapies that are available for everyone. Right. So, like you were saying, Dr. Aarti, let's move on to, you were talking about some strategies about गठिए की बीमारी है, exercise नहीं करी. So, what are some coping strategies that you recommend for individuals to effectively manage arthritis in their daily lives? Please.
It's like, different coping up.
Mhm.
First, that depends upon that. I'm telling you that it's either it's primary, cutting short, it's primary or secondary, right? For example, a patient has come up. There's a difference. Patient is a case of trauma. So trauma leads to further arthritis if he has not taken treatment, conservative. So in that, mobilization along with medical management, that is required. Trauma at knee. that leads to arthritis, that also requires surgical. But if patient have arthritis at younger age because of rheumatoid or because of say like because of multi system involvement, say psoriasis is there, right? Skin involvement is there. So I mean, you have to cope up according to the diagnosis, that it's either primary, it's secondary, it's multi-system involvement, it's because of trauma, it's because of infection, it's because of metabolic disorder, it's because of some autoimmune disorder, or it's because nutritional. Sometimes nutritional is there, sometimes arthritis. How can we cope up in OPD? Only fibromyalgia is there, pain throughout. But when we use the joint, there is no pain. At rest, the pain is there. At rest, the pain is there because joint is not mobilized. So, so diagnosis, primary, secondary, then your multi-system involvement, then other organs are also involved. Psoriatic is coming up very high. So psoriasis, if you think of, then again coming up, that what is the leading cause of? I am not a dermatologist, but still psoriatic arthritis is there. So psoriasis come because of what? What is the main etiology behind the psoriasis? If I ask you, so that is stress. That is related to stress. But it should be diagnosed in dermatology department. That's it. But patient has come up on the later stages. So that has lead to joint pains too. So that leads to psoriatic arthritis too. So sometimes the patient, along with that, so they go to dermatologists. They sometimes the systemic lupus erythematosus is there. So there are different. So coping up, it's not only that with me coping up with that. That all the specialties, these specialties, they should be involved, and so that at early time and early diagnosis should be made, so that we can cope it up in a right manner, and we should educate the patient that this is the disease, and this some autoimmune, because osteoarthritis is like degenerative, right? Rheumatic disorders is like autoimmune. Immune system is involved. So immune system is immune system, that is inflammation. So your internal system is deranged. Degeneration is we can cope up with. We can cope up with exercise, but immune system is something different. So there are different anti-inflammatories or inflammatory prokinins are there, cytokines are there. That is related with stress. Some things are related with your lifestyle modification. So to cope up both primary and secondary, there are different ways how to cope up. And moreover, all the specialties they are involved with, so that early diagnosis should be made. Mobility, of course, our main function will be mobility and improving the health of the patient. So that should be the main motto. So mobile, pain-free. Everything you have, everything in life you need a pain-free, right? So pain-free joint and your health, joint health, that is required. So for that, exercises, lifestyle management, and early diagnosis, that is required, what I feel like.
Yes, thank you for that descriptive answer. Talking about people living with arthritis, are there any support systems or resources available that can be put to use for having them lead a fulfilling life?
Definitely, there are different non-governmental organizations are there. Different patients should come up. That is in the OPD. Now there are different organizations. They're coming up forward. For example, our Indian Arthroplasty, I have told you. So there are different organizations in Bangalore. There is also one organization that I am involved with, Arthritis. So, and then the non-governmental organizations that are started by NGOs, they are also dealing with, because they have been diagnosed with arthritis at very younger age. I have come up with. So there are, I am associated with Indian Arthroplasty Association, Indian Orthopedic Association. So there are different, and they are coming up. We have, cells. They are in IOA cells, the rheumatic cells. They are going on, and we are trying that people should come up with this, and they should get aware with this, and if they can get benefits, of course, out of that, so that should be done. and so that early diagnosis should be made. It's not that in skin the patient has got an arthritis is there, it has come up with. So we are also collaborating with other specialties also, so that we can have interdepartmental meets, so that students should be aware of that. That in MBBS level we also aware. Then at camps we also bone and joint health camps we there. And I'll also request you if you can also provide us with these links, so that we can also go ahead with that, and we can also join our Indian Orthopedic Association along with you, so that we can go for another awareness camp, so that we can educate the patient about arthritis.
Thank you for giving us that opportunity. And right, I think you have summed up very nicely about the entire awareness that is required, the different management therapies that are there, about what is prevalence. So moving on to the challenges that clinicians such as yourself have seen or have faced or are aware of, that are going on in the different parts. So as we know that there are some notable regional variations in the prevalence, and there are obviously healthcare delivery is also different. So what do you feel are the certain challenges or barriers that are there in certain regions of India where we are not able to provide quality arthritic care?
I mean, what in your knowledge is there? If I ask you this question, what is in your mind as a layman?
I would say awareness, not knowing कि मेरे को घुटनों में दर्द है या ये this could be arthritis is, I think from the everything that I have understood in this call, in this session is what I understand.
I went to Rajasthan last week, right? I have seen 105 years old. I was going to near Hanumangarh, from Jaipur to Hanumangarh for vacations. So I have seen 105 years old male with no signs of arthritis. And I mean, I was surprised that मैंने पूछा कि तू डाइट में क्या खाता है? हाँ. अभी भी इंडियन टॉयलेट वो यूज कर रहा है, उसको इतनी अवेयरनेस है. अभी भी 2 चमचा देसी घी का जरूर खाता है. अभी भी वो ग्लूटेन फ्री हो या कुछ हो, आटा उसको ये मालूम है, पिसवा के खाता है और घर की रोटी खाता है. उसने कभी भी पिज्जा, कभी भी बर्गर और कभी भी मोमोज नहीं खाया. अगर हम सोशो इकोनॉमिक स्टेटस की बात करें तो नॉर्मली जब हम देखते हैं, नॉर्मली विद लो सोशो इकोनॉमिक स्टेटस, उनसे क्या पूछो उन्होंने क्या खाया है? चाय का ग्लास पिया है और रस खाया है.
राइट.
हाई सोशो इकोनॉमिक स्टेटस पे पूछेंगे, हमारा कोलेस्ट्रॉल बढ़ता है, हमें तो डॉक्टर ने मना किया, हम देसी घी नहीं खाते. तो आपको मोबिलिटी के लिए कुछ तो घी चाहिए.
करेक्ट.
So that's my answer if you can. So prevalence, I mean, India is such a big country. So it's very tough. Everybody has, because now the people are migrating to IT, right? They are shifting towards, metropolitan. They are not, I belong to Punjab. So मुझे अगर जाना पड़े दिल्ली मेट्रोपॉलिटन में, तो मैं पूछूंगी अपने आप से, मुझे देसी घी मुझे मिलेगा? तो फर्क है ना ये. तो हर एक अलग अलग प्रेफरेंस है, क्या है. तो बेसिक तो यही समझ आती है कि मोबिलिटी इज इम्पोर्टेंट, एक्सरसाइज इम्पोर्टेंट, डाइट मॉडिफिकेशन इज इम्पोर्टेंट, and early diagnosis at right time. But don't ignore your symptoms, please. Don't ignore your system, don't ignore your body. Whatever your body says is good, not the blood investigation is good, your body is good. And talk with someone whom you rely upon. Talk with someone. Don't ignore your health. Don't ignore your health. Either it's me, either it's you, or anybody.
Right.
And for you, take a banana too, right now, after this show.
Right, Dr. Aarti. Thank you.
That's a simple way.
Right. So talking about, I would say, the last part of our conversation about arthritis here, some strategies on improving the arthritic care that we see. So, one example is what we are doing right now. What other things do you feel can healthcare providers and communities work together to improve arthritic care at district levels?
Definitely at village level, at district level. So awareness camps should be there.
Mm-hmm.
Then people, they should get MBBS students, for example, at first year. Then at internship level, they should be, our main motto is that through our healthcare providers, then our sisters should be aware of it. Then our employees at the hospital, they should be aware of it. We should get camps done for arthritis. Then we should know that at which investigations and what are your signs and symptoms at right time, how they should be managed and how they should be treated, and where are the treatments, what are the treatment options are there. So awareness camps at district level, at hospitals, at villages, at different level should be there, so that healthcare providers should be aware of it. Whether it's at early stage, the diagnosis of arthritis should be made, and we should be aware that this treatment is given in this disease, this treatment is given. It's not that only one arthritis is there, only degenerative is not that, only osteoarthritis is there. Now different terminologies I have told to you, that osteoarthritis, rheumatoid arthritis, ankylosing, psoriatic, juvenile, gout. You've been aware only with the uric acid. So people are aware with ke mera uric acid बढ़ गया, but they are not. Sometimes patient is in remission, sometimes diagnosis is not made, sometimes it doesn't come up in the blood investigation, sometimes it doesn't catches up in radiological investigation. So that we should be aware with the signs and symptoms, and we should aware the people that if the symptoms are coming, that we should be we should we should get aware that we are going towards arthritis. It's not that it come up to the blood investigation. So at this point, awareness camps, I've told you, in villages, in hospitals, at MBBS levels, at internship levels, at nursing levels, at different levels, at Anganwadis. So at different the government organizations, they are coming up, for example, for tuberculosis and all these, they have in sugar. So there are different AIDS, cancer, but this arthritis is much more coming up highly fastly in our this society. So awareness camps should be there. That's it, what I can say.
Thank you, Dr. Aarti. I would like to thank you for stepping up and showing your interest, showing your voice for the awareness of arthritis. Any last key message or a takeaway that you would like to give to all the viewers about this lovely interaction that we have, please?
In nutshell, I would say that mobility and improve your health, that is very important. There is loss of livelihood entirely due to disease not being treated in India. So loss of livelihood, right? In India due to disease not being treated. So early diagnosis, emphasizing, and emphasizing about your diet, about your lifestyle. That is very important. If you are healthy, so nothing can combat. Health is wealth, and wealth is health. In nutshell, what I can say.
Thank you, Dr. Aarti. It was a lovely interaction with you. I'm sure all our viewers and had a good time. So I would like to thank Pfizer. I would like to thank you, Dr. Aarti, and thank all the viewers who engaged with us in this panel of discussion. Any parting words, Dr. Aarti, before we close this panel?
Thank you so much, Dr. Nishant, and thank you, Pfizer and Voice of Healthcare. And stay tuned, okay? And be healthy. Life is more important. Don't stress. And first, Dr. Nishant, take your breakfast.
Right,
That
Dr.
is
Aarti, obviously.
Right.
Right.
Bye.
I thank you. Thank you for your valuable time. And to all our viewers, stay tuned for more interactive discussions on arthritis. So thank you, Dr. Aarti. Have a good day.
Thank you so much. Bye.
Bye-bye.